Common extensor tendon sonoanatomy. It is very important while evaluating a lateral elbow pain. Most common cause of lateral elbow pain is penis elbow or lateral epicondylitis or lateral epicondylopathy. The common extensor origin of the elbow classically refers to the common tendon of the following forearm extensor muscles, which form a common footprint at the lateral epicondyle. It is found just distal to the origin of the extensor carpi radialis longus muscle, which is originated from supracondylar ridge, lateral supracondylar ridge. So here, this is the ECRL tendon, which is starting from the lateral supracondylar ridge. So here, this is the view 1. This dashed line you can see, this is the view 1, which will show this ECRL tendon and its origin. Then comes ECRB tendon, which is a part of common extensor tendon. So this is the view 2 dashed line, which will show the ECRB tendon origin. Then comes view 3. So this view 3 will be formed by extensor digitorum communis and extensor digiti minimi. So both these tendons will also form the common extensor tendon, and we will see them under view 3. Extensor carpi ulnaris is, you can see that origin is a bit posterior. So posterior and inferior origin of extensor carpi ulnaris also can be seen under ultrasound in this type of view. Now let us see these muscles in a 3D anatomy software. So this is the 3D anatomy software. We can see this muscle. This is the ECRL. So this is starting from the supracondylar ridge of the lateral side. Now after that, this muscle is the ECRB, extensor carpi radialis brevis. So, and this is a part of common extensor tendon. After that, this is the extensor digitorum. Then comes extensor digiti minimi, and then comes extensor carpi ulnaris. So these 4 tendons will mainly form the common extensor tendon. So let us proceed for ultrasound demonstration. Now position is volunteer is lying supine and elbow is 90-degree flexed. Patient can remain in sitting position also. Here I am using the linear ultrasound probe. Let me see the common extensor tendon in a long axis view. So first I keep the probe in a long axis direction. So here, what can I see? So I can see the lateral epicondyle, condyle and radial head. So this is the radiocapitellar joint. So here, if I go a bit more anteriorly, so this is the ECRL, extensor carpi radialis longus muscle belly, and left side I can see the cross section of lower end of humerus. So this is actually the position of view number 1. You can see the picture of view number 1. So this is the picture of view number 1. And till now I have not reached to the level of common extensor tendon. Now I am coming gradually to the common extensor tendon, and I will first see the ECRB tendon. So this is the appearance of ECRB tendon. Here ECRB tendon can be seen a fibrillar structure. In a fibrillar structure, this is the ECRB tendon. So this is the ECRB tendon, and this is the short axis view of the area of common extensor origin. The common extensor origin, all the tendons are coming here. So this is the tendon of ECRB. Now, if I come a bit posteriorly, then I will be able to see another tendon bulk, which is actually corresponding to the extensor digitorum and extensor digiti minimi tendon. But of course, it is very difficult to isolate these two tendon bulk here. But this is the area when I will show you in a short axis orientation. Then we can see that this is the area for other tendon. We can see in the picture that view 3, the tendon of extensor digitorum and extensor digiti minimi, which is a bit posteriorly positioned than the ECRB tendon. Now we can also see the radial collateral ligament and the annular ligament here. Now I am trying to see the extensor carpi ulnaris tendon. So from here, the direction of the probe will be a bit anterior. My position of the probe is posterior, but my direction of probe is a bit anterior. Here I can see the tendon of extensor carpi ulnaris. The short axis of common extensor tendon starts from this position. Let me go distally to see that how the muscles are formed from the tendon. So as soon as I go a bit distally, I can see that muscle bulk is coming out. So this is the extensor digitorum muscle. Then I will go a bit more. Now I can see two muscle bulks are coming out. One is extensor carpi ulnaris and second one is extensor digitorum on the right side. Now, as I go distally, more distally, then between these two muscles, there is another muscle coming out. So that is called extensor digiti minimi. Now, when I am seeing all the three muscles, I can see go anteriorly to see another two muscles, that is ECRL and ECRB. It is better to isolate them from above. So let me go again at the position of common extensor tendon. So this is the area of common extensor tendon short axis. Now, as I am coming down, I am seeing that again extensor digitorum has started. But now I want to see the more anterior side. Now, I can see one tendon which is having a scorpion tail appearance. This scorpion tail appearance is the tendon of extensor carpi radialis brevis. And then if I go more anteriorly, I can see the muscle bulk of both extensor carpi radialis brevis and ECRL, extensor carpi radialis longus. But here I am more interested in ECRB. Below I can see the muscle of supinator also over the radial head. So now you see how this ECRB tendon is gradually again going. I am going proximally to see that this tendon, how it is forming the common extensor tendon. How it is forming. So again, just I have crossed the radial head and this tendon is going and joining in the, now it is coming and joining in the common extensor tendon origin. So what is there posteriorly? So this posterior area is nothing but the joining area of extensor digitorum and extensor digiti minimi. So we can see that these two tendon bulks are separate. These two tendon bulks are separate. And then extensor carpi ulnaris is actually lying just posterior to the this common tendon of extensor digitorum and extensor digiti minimi. So this is the tendon of extensor carpi ulnaris. Join Asian Pain Academy to learn musculoskeletal ultrasound in depth and become more confident while doing the ultrasound guided pain procedures.